by the lack of adequate resources as well as transport to reach a wider number of clients. The work of different churches and religious groups like the Catholics and Muslims who advocate for the use of natural family planning methods needs to be recognized and fully supported.
The church has its own position, it has its own stand. Natural family planning allows these two people to accept even and respect the other person when in fertile or non-fertile periods.
As a Muslim society, we have what we call the natural family planning, which does not involve any devices, which is cheaper to upkeep the safety and the health of the woman, to have that natural spacing of the children.
The Protestant churches have a variety of community-based development programs that include provision of comprehensive family planning services.
Under family planning, we are telling families or congregants or the community at large that a household has to have a family that it can care for. And also we refer them to the Bible that having a family that you cannot care for well, that's an abuse before God.
Faith-based organizations command a wide following among their faithful. This presents an excellent entry point for re-energizing family planning services and programs.
Networking yetu imeshikana vizuri kabisa, na tumeona katika majaribio yetu kwamba hii kazi sio ngumu. Almuhimu tuweze kupata usaidizi wa kutupeleka mbele na kazi itafanyika vizuri sana.
The large number of young people in the population today is as a result of decades of large families. As these young people move into their childbearing years, they form a powerful force behind the growing population. Decisions made by these young people on the timing and number of their children will have long-lasting consequences for the pace of Kenya's population growth, the economy, and national development.
Most of our young girls, they know less about family planning. You'll find that she is a young girl, she has like 2 kids. The age bracket, it's too close. If she had the knowledge about family planning, surely she could not have done something like this. The government at large has failed somewhere in educating the young people, the young girls, on family planning.
The youth are among the most vulnerable in the society when it comes to the issue of reproductive health. Today, youth are falling prey to risky behavior that predisposes them to unwanted pregnancies, early marriage, and the risk of contracting HIV.
If they realize that they are pregnant and the young man who is responsible refuses to take responsibility over the pregnancy, there is another thing also comes up, procuring an abortion, and the abortion issue comes up again.
We have the sessional paper on population and development. We have the guidelines and protocols on service delivery to young people, but we have no services. Only about 12% of health facilities provide services to young people. So there's a mismatch between what we are saying in our policies and what we are actually doing.
Awareness and sensitization programs that will empower the youth about their sexuality need to be stepped up and included in the school's curricula.
60% of the population is youthful, and there are very potential clients there who are low parity, who need the type of family planning, who doesn't have information at the moment.
To realize the goal of re-energizing family planning, leaders need to be more engaged. Here is what one young person had to say about their leaders' responsibilities.
First, I will tell them to come out of wherever they are, because they are hiding themselves. They are like burying their heads in the sand. They should come out and tell the young people, these are the contraceptives, this is what is there, but because of your age, because of who you are, and because of your religious background and whatever that you believe in, you are not supposed to use them until a certain age.
parliamentarians and other influential leaders is crucial for mobilizing funding from all available sources and advocating for strengthened services.
Life and death is a political decision. And I examined myself and realized that it is true that politicians are the ones who provide funding to provide maternal health care. It is the politicians who make also legislation to kind of ensure that whatever they legislate or the laws they formulate are in protecting the lives of the citizen.
More members need to get actively involved in the parliamentary committees and networks that address population, health and development issues. It is imperative that the government, policymakers, leaders of non-governmental organizations, faith-based groups and the private sector incorporate family planning services in all their development initiatives. For example, family planning needs to be fully integrated in the programs of control and management of HIV and AIDS, such as in programs to prevent mother-to-child transmission of HIV. Family planning may be one of the best-kept secrets in HIV prevention. Simply improving the availability of family planning could prevent scores of new infections each year.
We need to restore some kind of balance. And as I was saying earlier, to get a more integrated national program where HIV, AIDS and other aspects of sexual and reproductive health, including family planning, are brought more closely together and reintegrated. I think that's the way forward.
For Kenya's development vision of 2030 to be realized, repositioning family planning higher on the national agenda and to a higher priority in our development plans is crucial.
Unless, as a country, we make a very clear decision to reposition family planning, to allocate resources for family planning, to advocate for family planning, we are unlikely to achieve, for example, the MDGs.
Government itself, to see the family planning program as an integral part of sustainable development and funding.
We have to reposition family planning so that we can be able to have better families and have better living standards in our country.
In a nutshell, as a country, we need to analyze and implement the following. Review existing policies and their effect on contraceptive availability and use. Assess the budgetary allocation for reproductive health services, including family planning, to ensure it is adequate to meet the current needs. Focus both on the supply of and demand for contraceptives. That is, make sure that the products are available and provide information and counseling to women and men who need them. Identify gaps or weaknesses in training programs for health workers, as well as our ability to provide effective supervision and staff motivation and strengthen areas of need. Address procurement and distribution of contraceptives with a particular focus on ensuring adequate supplies in rural health facilities. Identify target audiences such as sexually active youth, married couples and men, and intensify information campaigns tailored for these specific groups. Analyze the effects of the shift in funding from family planning to HIV/AIDS and increase efforts to integrate family planning programs with HIV/AIDS and other maternal and child health programs. Although we have lost a decade, together we can recapture the energy and commitment that made Kenya's family planning program the jewel of the region. By helping all Kenyans achieve their desired family size, we can go a long way towards meeting two goals: vastly improving the health and lives of millions of women, girls, their infants and families, and bringing the rate of population growth more in line with a pace of socio-economic development that is manageable and sustainable. Let us make the next decade count.